Good day. My name is Eugene Jul Gemarino, and I'm going to present a slideshow regarding substance use disorder. This is for fall semester 2022 to 2023, and course is Mental Health Nursing, NRSG-106-001, NRSG-106-002. Saskatchewan Polytechnic, and my instructor is Carol Moore. Substance use disorder. Substance use disorder encompasses varying degrees of excessive use of a substance, including alcohol, tobacco, opioids, caffeine, cannabis, hallucinogens, inhalants, sedative, hypnotics or anxiolytics, stimulants, examples are amphetamine, cocaine, and more. Various mental health conditions such as depression may co-occur along with substance use disorder, a treatable medical condition that affects the brain and involves compulsive and continuous use despite negative impacts to a person, their family, friends, and others. Tolerance. When a person who uses drugs or alcohol becomes accustomed to a particular dose and needs higher amount in order to obtain the same effect. Dependence. A body's natural reaction when certain substances are used for an extended period of time. The body gets used to a regular supply of the substance, and if the dose is lowered or stopped, a person can experience withdrawal symptoms. Withdrawal. A natural reaction that may occur when a person reduces or stops taking drugs or alcohol after using regularly for a long time or after using high doses. In some cases, and depending on the substance, withdrawal symptoms can be extremely debilitating and make it very difficult to stop or lower the dose. Symptoms can include nervousness, irritability, agitation, chills, sweating, diarrhea, nausea, stomach pain, insomnia, body aches, and widespread or increased pain. Risk factors. Biological risk factors can be genetics, age, and gender. Psychological examples are events in life, especially trauma and chronic stress. Then mental well-being, like emotions, thoughts, feelings, and mental illness. Socio-cultural. These are drug availability, poverty, peer pressure, and cultural. The brain and substance use. The human brain is the most complex organ in the body. This 3-pound mass of gray and white matter sits at the center of all human activity. Your brain is you, everything you think and feel, and who you are. The brain is made up of many parts with interconnected circuits that all together as a team, and different brain circuits are responsible for coordinating and performing specific functions. Networks of neurons send signals back and forth to each other and among different parts of the brain, the spinal cord, and nerves in the rest of the body. Example, the peripheral nervous system. To send a message, a neuron releases a neurotransmitter into the gap or synapse between it and the next cell. The neurotransmitter crosses the synapse and attaches to receptors on receiving neuron, like a key into a lock. This causes changes in the receiving cell. Other molecules called transporters recycle neurotransmitters, that is, bring them back into a neuron that release them, thereby limiting or shutting off the signal between the neurons. Basal ganglia plays an important role in positive forms of motivation, including the pleasurable effects of healthy activities like eating, socializing, and sex. and are also involved in the formation of habits and routines. Drug use overactivates the circuit eventually, and repetitive use diminishes its sensitivity. The extended amygdala plays a role in stressful feelings like anxiety, irritability, and unease. Characterize withdrawal after the drug high fades, thus motivates the person to seek the drug again. The prefrontal cortex powers the ability to think, plan, solve problems, make decisions, and exert self-control over impulses. The last part of the brain to mature, making teens most vulnerable, makes a person with a substance use disorder seek the drug compulsively with reduced impulse control. The brain and substance abuse. The brainstem controls basic functions critical to life, including heart rate, breathing, and sleeping. Opioid overdoses can cause depressed breathing and death. Some drugs target the brain's pleasure center. Just as drugs produce intense euphoria, they also produce much larger surges of dopamine, powerful reinforcing the connection between consumption of the drug, the resulting pleasure, and all the external cues linked to the experience. Large surges of dopamine teach the brain to seek drugs at the expense of the other, healthier goals and activities. The phase of substance use crisis. My patient profile. My patient is Neil Guzman. He is 30 years old, male. He moved to Regina, Saskatchewan from the Philippines a year ago, lives in a one-bedroom apartment with his mother, admitted due to opioid use disorder and suffered from an overdose. Medical history includes hypertension. No official diagnosis of other psychobiological disorder, but his mom noticed symptoms of depression such as feeling of helplessness, low self-esteem, and feeling of anxiousness. No strong support aside from his mom. He is not able to connect and create meaningful relationship. Therapeutic communication skills. Nurse Eugene. Hi Neil, my name is Eugene and I am your nurse for the next 3 days. It looks like we will be looking into creating a plan for your possible discharge. How do you feel about that? This skills is introducing self and setting the goals with the patient. Patient, Neil. Okay, I guess I'm scared that I may go back to my bad habits and fall into more serious conditions next time. As a nurse, I am going to ask what happened to you certainly, or tell him what happened to you certainly look quite serious. Tell me more about your fear and what do you think will hinder the progress of your treatment. This communication skills is emphasizing the reality, encouraging the expression of feelings. Nursing diagnosis is ineffective coping related to inadequate effective coping skills in abuse, in substitute to substance abuse. The outcome, patient will be able to identify effective coping behaviors and use effective coping skills learned. The goal, patient will be able to commit and going to group activities and commit in using learned coping skills. Intervention is structured diversional activity that supports recovery, such as social activity within support group and self-help peer groups, wherein issues of being chemically free are examined and there is a promotion of abstinence in each member. Using understanding, support, and peer pressure. Evaluation would be goal met. Patient stated that he is consistently attending the activities on peer group arranged for him and he is finding this very empowering and helpful in his road to recovery. Nursing diagnosis. Risk for injury related to history of opioid. Outcome would be patient and his mother will be able to identify signs and symptoms of overdose and will be able to initiate Narcan when necessary. Our goal is patient and his mom will be able to participate and resonate learned education regarding overdose signs and symptoms and use of Narcan. Intervention. Nurse will discuss symptoms such as dilation of pupils, decreased respiration, convulsions, coma as signs of opioid overdose. Nurse to refer patient and mother to a pharmacist for Narcan use education. Evaluation. Goal met. Patient and mom able to distinguish signs of overdose versus intoxication and aware of resources where they can get Narcan and use it when overdose is suspected. Buprenorphine naloxone. Brand name Suboxone. This drug indication is first-line treatment for opioid use disorder (OUD) in adults. Buprenorphine is absorbed sublingually. It is taken regularly. It will make other opioids less rewarding. People taking Bupanol may experience less anxiety and depression. A missed dose is not likely to cause withdrawal symptoms. Patients may go without a dose for up to 5 days and still be restarted on their previous dose. Crisis intervention resource. If opioid overdose is suspected, call 911 emergency line if you or someone else is at immediate risk of harm. Call 811 Helpline Saskatchewan or of confidentiality 24/7 health and mental health and addictions advice, education and support telephone line. Crisis services provided by Mobile Crisis Services Incorporated, Regina. Their website is www.mobilecrisis.ca. Their hotline is 306-757-0127. After hours is 306-757-0127. And business line is 306-757-7809. And these are the two community support groups that I chose. We have Narcotics Anonymous meetings provided by Southern Saskatchewan area of Narcotics Anonymous. Their business line is 306-757-6600. Service website is www.southsaskatchewanna.org. Meetings. Email is publicrelations@saskatchewanna.org. That's the coverage area. And addiction services, Regina Opioid Addiction Treatment Clinic, provided by Saskatchewan Health Authority, Regina Capel Health Region. Their address is 1640 Victoria Avenue, Regina, S4P 0P7. Their main office phone number is 306-766-6600. Their fax number is 306-766-7970. Adult Addiction Services. For services, call 306-766-6600. The service website is Addiction Services in Regina. You can see it at rqhealth.ca. For closing, I got this quote from an anonymous person. I'm not telling you it is going to be easy. I'm telling you it's going to be worth it. And these are my references. So I am now closing my presentation. I hope everything is clear, and if you have any questions, please let me know. Thank you.